Hello medicos, we're back with another session here. Here I am taking a topic of Wilms tumor, nephroblastoma, which is a most common pediatric renal tumor or second most common abdominal tumor in children, the first one being neuroblastoma. So it should be differentiated from neuroblastoma because both of them presents as abdominal mass. First of all, to differentiate it from neuroblastoma, see the age group. The neuroblastoma generally occurs in the age group less than 2 years of age, while Wilms tumor is common in the children with the age between 3 to 4 years and usually less than 5 years. Usually it arises from one of the pole of kidney. As you can see here in this diagram, from one of the pole of kidney, this tumor is arising. In the later stage, it involves the whole kidney, but it start as confined to the one of the pole. Now, here you can see this unilateral enlargement of abdomen. It is mostly sporadic, but if familial, it can be associated with 3 syndromes, which are located on 11, associated with WT gene located on 11p chromosomes. First syndrome is Weger syndrome, then Danish-Drass syndrome, Beckwith-Wiedemann syndrome. Weger syndrome, W for Wilms tumor, aniridias, genitourinary abnormalities, and mental retardation, which is associated with WT1 gene and deletion of 11p13 and PEX6 gene. Danish-Drass syndrome mainly associated with WT1 gene but only deletion of 11p13. In a Danish-Drass syndrome, there is gonadal dysgenesis, pseudohermaphroditism is there, plus diffuse mesangial sclerosis in the kidney can be seen. In Beckwith-Wiedemann syndrome, it is associated with WT2 gene, while other two syndromes associated with 1, this Beckwith-Wiedemann syndrome associated with 2, WT2 gene, and 11p15.5. In the Beckwith-Wiedemann syndrome, there is a hemihypertrophy, and also the macroglossia, hepatomegaly, organomegaly is there in Beckwith-Wiedemann syndrome. Everything just enlarge. So there is hemihypertrophy, the half set of body get enlarged. Macroglossia, tongue enlarges, liver enlarges, hepatomegaly, omphalocele, adrenomegaly, and Wilms tumor. Beckwith-Wiedemann syndrome associated with some cancers, and there are risk of cancers here. If there is hepatomegaly, it can lead to hepatoblastoma, adrenomegaly, adrenal cortical cancer, Wilms tumor, rhabdomyosarcoma. Note: mental retardation is associated with all 3 syndromes described earlier. Macroscopically, if you will look at the Wilms tumor specimen, you will find it to be very fleshy tumor. As you can see here in this diagram, this is a very fleshy tumor. It resembles like a fish flesh. Microscopically, 3 components are there: epithelial, stromal, and blastomal. Epithelial stands for tubules. These tubules are epithelial components, and mesenchymal, also known as stroma. So these mesenchymal stroma is there, and the blastomal are just a cells arranged like this. You can see if there is more blastomal component, it is associated with a poor prognosis. Now coming to the clinical features of Wilms tumor: abdominal mass which never cross midline, while in the neuroblastoma the abdominal mass is there which crosses the midline. Pain, fever, hematuria. Staging: CECT is used to stage this Wilms tumors, and bilateral Wilms tumor is considered as stage 5. Calcifications are rarely seen in the Wilms tumor, but it is very common with the neuroblastoma. Coming to the management aspect, it can be managed surgically, chemotherapy. Surgically, you can manage it by doing partial nephrectomy or radical nephrectomy. Partial nephrectomy is preferred if the tumor size is less than 4 cm, restricted to poles in solitary functioning kidney, bilateral Wilms tumor. Radical nephrectomy is preferred in otherwise all other cases. Chemotherapy is VCD, that is vincristine, cyclophosphamide and dactinomycin. Describing the staging more here, and this is very important for exams also. This SIOP staging is very important. SIOP stands for Society of International Pediatric Oncology, in which it is associated with the shrinkage of tumor using pre-operative chemotherapy, while in National Wilms Tumor Study Group, surgery is done which is followed by chemotherapy. The most common site of metastasis in Wilms tumor is lungs, and most important prognostic factor is grade or histology of tumor. This is also asked frequently, that what is the most important prognostic factor in Wilms tumor. So it is histology of tumor. And remember this SIOP too, that it is associated with, first of all you will give here chemotherapy, and which leads to shrinkage of tumor, and afterwards go for surgery, while in National Wilms Tumor Study Group, first of all surgery which is followed by chemotherapy. Thank you for watching my video. Do share your views by commenting here. Thank you.